Hello and welcome to the GI Lab orientation. This presentation is an introduction to the skills lab that you will be completing soon. The objectives listed here are things that you will be able to do once you finish this presentation. That is to discuss the purpose of the skills lab, identify common equipment used in the GI lab procedures, as well as describe one goal of the skills lab. In order to assess your basic knowledge of skills lab as well as the equipment used in the GI lab, just basic knowledge, these questions were formulated. So I want you to think about and answer these in your head and about what answers you want to provide. What is the purpose of a skills lab? What is the name of this piece of equipment commonly used in the GI lab? The picture there. And then what is one goal of implementing the skills lab into the GI lab? So when thinking about your skills lab and the purpose of it, it's really important to know that the skills lab is there to develop the new nurse orientee coming into the GI lab, that nurse's knowledge and confidence. So we want to build your knowledge and confidence and give you the skills needed to develop further knowledge and confidence within the GI lab procedures. Whelan, Shih, and York state that research has shown that scripted simulations designed for specific areas of expertise can help a novice nurse grow into an expert role through practice and the opportunity to receive cues from the rest of the OR team in an environment where there is no risk to the patient. It's common practice sometimes for hands-on learning to be done within the procedure room, doctor there, anesthesia there, you name it, the whole team, patient, everything, and you're learning for the first time. That's great, but it would be nice to have the opportunity to learn your basic skills and knowledge without the pressure of having a patient on the table or a procedure going and dealing with that in addition to learning the basic skills needed to know. So that's where a skills lab comes in. It takes that pressure off and says, here, learn your skills, learn your technique, learn how to handle the equipment, develop those skills, and then let's take them into the procedure room with the patient. So that's the idea, to help you gain that confidence in those basic procedures, and then eventually take them into the procedure room through the rest of your orientation. Which kind of goes into that last little tab there, skills lab training, providing the new nurse the opportunity to learn the procedure equipment in a safe environment. So with that said, it is important to gain that knowledge and to let the skills lab training help you learn in a safe place. Some goals for your skills lab training. First, I want to look at kind of what we are wanting for your skills lab as far as your health promotion within the GI lab. So looking at the Nursing Theories website and their article about Nola Pender's health promotion theory, she has 13 competencies within her framework, and our skills lab would have you falling under perceived competence or self-efficacy to execute a given behavior increases the likelihood of commitment to action and actual performance of the behavior. So in other words, with the skills lab training, we want to give you the opportunity to learn these basic skills and equipment uses and techniques in order to build your commitment to utilizing them properly after orientation, when you're gaining your experience and knowledge, and keep going and make that commitment to keeping the behavior going. And that way, when you're training new nurses later on, you're training them the same way you were trained, and it all provides consistency. Also, another goal for the skills lab training would be completing the orientation procedure skills lab with preceptor. So basically just completing that lab, just going through all the basic skills and knowledge and all the equipment, getting your hands on them and practicing them just kind of in that safe environment. Another goal would be, between experience with the equipment, with the lab and hands-on patient experience. Some of the things that will be on the pathways checkoff sheet will not be a part of the actual skills lab, and they will be more so within the procedure. They'll be talked about in the skills lab, but not actual equipment in the skills lab will be used or able to be used. Some of that stuff will have to be done with hands-on experience with a patient and within the procedure itself. That is not too many things, but some things will have to do that. But by the end of your orientation, every single procedure that we do in the GI lab should be checked off your sheet. So, some of your non-common procedures would, if you are in a different area in the GI lab, then you go back when that procedure done so you can get it checked off your sheet. That's how that, that goal should be completed. What exactly will the skills lab training include? Well, this will be a half day of your orientation that will fall within the tech week of the GI orientation. It will also include the use of hands-on training of the GI lab equipment outside of the procedure room with a designated preceptor. The equipment used is for training purposes only, so we can kind of manipulate that and do different scenarios. If something breaks or if something doesn't work quite right, sometimes there's ways of troubleshooting that, and that's where the technician or the preceptor would help teach you those different aspects of utilizing the equipment properly. Also, there will be a designated preceptor that will teach the proper use of equipment and software for the GI procedures. So not only do you have to use the equipment properly, you have to learn how to manipulate the software on the processors and computers for the equipment. There are certain settings and numbers that need to be discussed and included in the training because they're important to know and to ensure that the monitors are set up properly for each procedure for the doctors. And then finally, it is the responsibility of the orientee and the preceptor to ensure each checkoff is covered within this portion of the orientation. So it's important to make sure each one of those little checkoffs gets signed. That way we know it was covered and that the skills lab is working properly. These are just some examples of the procedure equipment that are used, just some of the more common equipment that is used. So this right here is called the biopsy forceps. This is used probably the most commonly between the different procedures. This is just going to take a little tiny tissue sample and allow us to send that off to pathology to be read over. This right here, endoscopy scope. This is, one of the scopes that are used. We have colonoscopy scopes. We've got EGD scopes. We've got pediatric scopes. We've got different scopes for a procedure called an EUS. There's all these different scopes, and those will all be shown to you within the skills lab. This right here is the polypectomy snare. So doctor says, I'll take a snare for this polyp. This is what you'd get out. It's got a little loop on there that goes over the polyp, and then you tighten it up, and then they cut it off. and then they can suction up the polyp. So this is kind of your next most common equipment that is used, and there again will be accessible during the skills lab for you to manipulate and touch and handle and learn how to use that. This right here would be your tripod. We've got the three prongs there. This is kind of a common thing that will be used to remove a foreign body or a food, retained food in their esophagus that could be caught within a stricture. This will be most utilized while on call. This is the piece of equipment. You can use it during regular hour, regular scopes if needed, but will mostly be used when on call. So it's a good thing to be aware of and to get your hands on before you're called in for an emergency and have to learn for the first time. Some of the benefits to the training within the skills lab. So as a new nurse, you will become more confident in the procedures and use of equipment as you step into that next role of training within the procedure room. Again, this kind of goes back to your goal of boosting that confidence and knowledge about procedures and use of equipment in order to help build you into an expert nurse for this specialty. It will help you it will help with building and maintaining a healthy relationship within between the new GI nurses and the fellow GI veteran nurses. So kind of bridging that gap as veteran nurses have been there a long time. We find this everywhere we go. If we're a new person, it takes a little while. Well, having a skills lab will help give you that boost of knowledge and confidence and help kind of bridge that gap of the veteran nurses versus the new nurses and help kind of build a cohesiveness between the two. McGuire also suggests that programs for training new nurses ensure that they have protected time and learning resources that are unique to each specialty. So this is where, having that half day come in, it gives you that ability to get your hands on the equipment in a safe environment and a set amount of time. You don't have to be rushed or anything like that. It just gives you the opportunity to help build that knowledge base about the equipment use and handling. So here are those test questions again. This will be your post-test assessment, and we'll kind of go through them, and I want you to think about your answers and how you would answer them now that we've gone through the presentation and discussed all aspects of the skills lab and why we're going to implement it and have you go through it. So first of all, what is the purpose of a skills lab? So basically, I said this multiple times during the presentation. A skills lab, the purpose of it would be to boost your confidence and knowledge within GI lab procedures. I mean, that's our main goal. We want you to be confident in the procedures and we want you to be knowledgeable about what you're doing. Secondly, what is the name of this piece of equipment commonly used in the GI lab? That little picture there, what is the name of that piece of equipment? That is the biopsy forceps. So that's probably your most common piece of equipment used. We looked over those pictures a little bit ago about the most common kind of equipment that will be used in the GI lab procedures, as well as presented to you within the skills lab itself. And then lastly, what is one goal of implementing the skills lab in the GI lab? Well, one goal, there's a couple different ones, but one goal would be gaining that experience with all the procedures in the GI lab and getting that hands-on experience. Another goal would be completing that skills checkoff with your preceptor. Here are those post-test questions or answers again to those questions, if you'd like to look over them. Thank you for participating and learning with this education presentation about Skills Lab and why we want to implement it for you within your orientation. These are the references utilized for this presentation. I wish you the best of luck in learning and hope that the Skills Lab benefits you the way it should. Thank you.